When something smells off down there, it's not just a quirk of your body. It's a signal. Your body doesn't lie. It doesn't hide issues behind fancy packaging. It speaks in symptoms, in sensations, in discharges and odors. And when it does, your job is to listen. Not to dismiss, not to normalize, and definitely not to feel embarrassed. Ignoring a foul smell or unusual discharge is like ignoring a smoke alarm because you don't want to disturb the guests. It may feel inconvenient, but the cost of silence is much higher. A healthy vagina has a smell. It's natural, slightly musky, sometimes even sweet or metallic depending on your cycle. But when that smell shifts to something fishy, sour, or rotten, that's not nature, that's a red flag. It's your body warning you that something is off balance. Maybe it's a yeast infection. Maybe it's bacterial vaginosis. Maybe it's an STI, but none of those get better with time or ignorance. Same goes for discharge. It's part of your daily cycle. Thick or thin, creamy or clear, your body's way of cleansing and maintaining pH. But when it turns green-gray, chunky like cottage cheese, or comes with itching or burning, you're not supposed to through or wait and see. That's not bravery. That's denial. You wouldn't ignore blood in your urine or a pain in your chest. Vaginal health deserves the same respect and urgency. Let me be blunt, masking the odor with perfumes, soaps, or sprays. That's not solving the issue. That's like spraying air freshener in a moldy room. It hides the smell but lets the problem grow. Feminine hygiene products that promise to make you smell like flowers are part of the problem. They shame you into believing your natural scent is wrong, and they interfere with your body's chemistry. Stop trying to cover it. Start trying to understand it. Too many women are raised to feel embarrassed about their bodies, to avoid talking about discharge, to whisper about infections, to think discomfort is normal. It's not. Pain, odor, irritation, these are not just part of being a woman. They are signals that you need to care for yourself. That means seeing a gynecologist, getting tested when something changes, and refusing to let embarrassment be louder than your intuition. And no, it's not always about sex. Hormones, antibiotics, stress. Even tight, synthetic underwear can disrupt your balance. But yes, if you're sexually active, that's another layer. You owe it to yourself and your partner to be honest, responsible, and informed. If you wouldn't want to receive an untreated infection from someone, why would you risk giving one? Stop accepting silence. Stop brushing things off. Your sexual health is not a luxury. It's foundational. It affects how you feel about yourself, how you relate to your partner, and how your entire body functions. When your body speaks, especially through discomfort, odor, or change, listen, act. Respect yourself enough to treat your health like it matters, because it does. When your body starts giving off a strong or unusual odor, especially from the vaginal area, it's not something to brush aside or rationalize as normal. This isn't about being overly cautious. It's about recognizing your body's communication system. A healthy vagina does have a natural scent, and normal discharge varies with your cycle. But when that smell turns sharp, sour, fishy, or just wrong, and it's paired with abnormal discharge, thicker, discolored, or irritating, it's a clear sign that something needs attention. This isn't about hygiene or being clean. This is about internal balance, and when that balance is off, your body speaks. Unfortunately, many women are taught to normalize discomfort or dismiss symptoms as just part of being a woman. But a change in odor or discharge is not simply an inconvenience. It can be a sign of bacterial vaginosis, a yeast infection, trichomoniasis, chlamydia, or other sexually transmitted infections. And these aren't conditions to take lightly. Left untreated, they can lead to pelvic inflammatory disease, fertility issues, chronic pain, and serious complications. Yet far too often, women delay seeing a doctor out of embarrassment, fear, or misinformation. The idea that unusual discharge or odor isn't worth a medical visit is deeply harmful. Your sexual and reproductive health deserves urgency and respect. These symptoms aren't shameful. They're biological signals, just like chest pain or a high fever. They're not something you tough out or hope will disappear. Early intervention is key. In many cases, infections are easy to treat with medication, but only if you catch them before they spread or worsen. Your body works hard to maintain a healthy environment, and when that ecosystem gets disrupted by hormones, stress, sex, antibiotics, or synthetic fabrics, it lets you know. Ignoring it not only puts your health at risk, it can also affect your relationships and emotional well-being. Discomfort, Irritation and self-consciousness about odor can take a toll on confidence and intimacy. Listening to your body isn't paranoia. It's empowerment. It's a commitment to honoring yourself enough to act when something feels off. Because these signals are never random. They're purposeful, protective, and worth your attention. Ignoring them is not strength. It's avoidance. And when it comes to your health, silence is never safety. Using perfumes, scented soaps, or so-called feminine hygiene products to mask an unusual odor or discharge is not care. It's avoidance in disguise. These products don't treat the root cause, they simply try to hide it, and often they make things worse. The vaginal environment is self-regulating. It maintains its own pH, its own moisture levels, and its own bacterial balance. When you introduce artificial fragrances, harsh cleansers, or heavily marketed sprays into that environment, you're not cleansing, you're disrupting. What may smell like flowers for a moment often leads to burning, dryness, more discharge, or increased irritation hours later. The problem here is not just what these products do, but what they represent. They feed on the shame women are taught to feel about their bodies. They're marketed with the idea that your natural scent is something to be corrected. That being fresh means smelling like cucumber, mint, or spring breeze. That you should be concerned with how your body smells to someone else, instead of what your body is trying to tell you. And the real tragedy is that so many women believe these messages instead of trusting their own instincts. When something smells off or the discharge changes, that's not a cleanliness issue. It's an internal issue. Bacterial imbalance, infection, inflammation. And no soap in the world can fix that. Covering the symptoms doesn't heal the source. In fact, many women use these products thinking they're doing the right thing, only to end up making the situation worse. Fragranced products can cause allergic reactions, strip away protective bacteria, and even delay a proper diagnosis by concealing symptoms. Instead of grabbing a scented wipe, the response should be observation and action. What exactly has changed? When did it start? Are there other symptoms? Itching, burning, pain, or changes in texture or color? These questions matter. They help you understand your body's rhythm and signal when it's time to see a healthcare provider. The more you rely on artificial solutions, the more disconnected you become from your own health signals. Respecting your body means not silencing it. It means not telling your body to be quiet with a fragrance when it's trying to scream with a symptom. True hygiene doesn't come from a bottle. It comes from awareness, responsiveness, and the courage to stop covering up what needs to be addressed head-on. From a very young age, many women are taught to keep quiet about their bodies, to whisper about periods, to hide tampons, to feel uncomfortable even saying the word vagina out loud. This culture of silence runs deep, and when it comes to things like discharge or vaginal odor, that silence becomes even heavier. It creates shame around perfectly normal bodily functions. So when something does go wrong, when there's a strong odor, a strange color, or discomfort, many women freeze. They question whether it's serious, whether it's normal, whether anyone else deals with it. And too often, they say nothing. This learned silence is dangerous. It delays care. It tells women to endure symptoms rather than respond to them. It teaches girls to internalize embarrassment instead of prioritizing their health. As a result, infections go untreated, conditions become chronic. And the internal message becomes, "This is something I should be ashamed of," rather than, "This is something I should address." That kind of thinking is not only outdated, it's harmful. Open communication about vaginal health is essential, and that means making space to talk about discharge, smell, and discomfort without judgment. But in too many homes and relationships, these conversations still carry stigma. Even in some medical settings, women report feeling dismissed or rushed when they bring up these symptoms. That only deepens the fear and fuels the shame. The truth is, your concerns are valid. Your symptoms matter. And your voice should be heard clearly and confidently when it comes to your own health. Silence also breeds misinformation. If women aren't taught about the difference between normal and abnormal discharge, how are they supposed to know when something's wrong? If the only messages they hear are about smelling fresh or staying clean, they're not being empowered, they're being misled. Education is power. Awareness is power. But it starts with honesty. Honesty with yourself and with others. You shouldn't have to be in crisis to start talking about your body. The more we normalize conversations around vaginal health, the more women feel equipped to take action instead of hiding behind shame. That change begins with rejecting the silence that has been passed down for generations. Your body isn't something to be embarrassed by. It's something to be cared for. And that begins with giving it the voice and attention it deserves. Taking action when something feels off is not overreacting. It's a powerful form of self-respect. When you notice an unusual smell or discharge, that's your body's way of alerting you to a possible issue. The responsible choice isn't to wait it out or hope it resolves on its own. It's to respond. Prompt attention to these symptoms doesn't just protect your reproductive system, it strengthens your relationship with yourself. It sends the message that your well-being matters, that you're willing to advocate for your health, and that your body is worthy of care and attention, not silence and neglect. Delaying care can have real consequences. Infections that start off minor can lead to far more serious issues if they're left untreated. Conditions like pelvic inflammatory disease, chronic pain, or fertility problems. And when a sexually transmitted infection goes unnoticed, not only are you at risk, but your partner may be too. This isn't just about you. It's about being responsible in the context of intimacy and partnership. If you care about someone, you protect them by protecting yourself. Honest communication and regular checkups are not overreactions, they're essential elements of a healthy sexual relationship. There's also the emotional side of it. Living with discomfort, irritation, or fear about your body can take a toll. It affects your confidence, your energy, your desire to be close to others. That constant worry, do I smell? Will they notice? Becomes exhausting, and none of that is necessary when answers and treatments are often simple and accessible. You don't have to live in discomfort. You don't have to ignore your intuition. The sooner you respond to changes, the sooner you get clarity and peace of mind. Being proactive about your sexual health also builds self-trust. It teaches you to tune in rather than check out. You begin to understand what's normal for you, what signals mean, and how your body responds to stress, changes in diet, or hormonal shifts. That kind of awareness is empowering. It turns fear into clarity and hesitation into action. Ignoring your body's signals doesn't make you stronger or tougher. It just puts your health on the line. Choosing to act, to ask questions, to seek care. That's what real strength looks like. It's not dramatic. It's not overthinking. It's choosing to value yourself enough to listen and respond when your body asks for help. Our body is always communicating with you. Through smellage, discomfort, and subtle changes. These signs aren't random. And they're certainly not something to be ignored or hidden. They are your body's way of protecting you, urging you to pay attention, to take action, and to care for yourself with the urgency and respect you deserve. When you choose awareness over avoidance, when you replace shame with education, and when you listen instead of silence, your health, confidence, and relationships all thrive. Don't wait for things to get worse. Respond the moment your body speaks.